Hello everyone, and welcome to a new We Teach video. In this video, we're going to discuss a commonly tested concept, which is Virchow's triad. Virchow's triad describes the three factors that increase the risk of thrombus or blood clot formation within a blood vessel. So what are the three factors? Endothelial injury, stasis, and hypercoagulability. Let's take a closer look at each of these factors. Starting with endothelial injury, which is the single most important factor. Endothelial injury basically means that we have an injury to the vessel wall, and that injury exposes the subendothelial collagen, which leads to the activation of the clotting factors, leading to a clot formation. Insults that cause endothelial injury include hypertension, high cholesterol or hyperlipidemia, toxins like smoking, infection, ischemia, and surgery. Next, we have hypercoagulability, which means that there is an increased tendency to form a clot. And that increased tendency can be due to an inherited or acquired cause. Inherited causes have to do with abnormalities of the clotting cascade. That means that we either have an increased production of factors that cause the formation of a clot, or deficiency or decreased production of those that break down a clot. So this includes thrombophilias, protein C or S deficiency, antithrombin deficiency, and factor V mutation. Acquired causes include pregnancy, oral contraception use, smoking, cancer, and chemotherapy. The third and last factor is stasis or turbulence in the blood flow. Stasis means that the blood is not moving in the vessel, and that can be due to immobility, like a patient who is on bed rest or people who are traveling on long flights. It also includes obesity and heart failure. Turbulence is abnormal flow of blood. So the normal flow of blood is said to be laminar and the blood is flowing smoothly through the vessel. However, when there is an abnormality in the blood flow, it's said to be turbulent flow, and that increases the risk of stasis and endothelial injury, and hence increasing the risk of clot formation. So we're done with the three factors of Virchow's triad, but I want to discuss a very important concept, which is that when we talk about Virchow's triad, we're talking about factors that increase the risk of thrombus formation. And thrombus is not the same as an embolus. What's the difference between the two? A thrombus is when a blood clot forms within a vessel and then obstructs that vessel. Whereas an embolus is when part of that blood clot dislodges and starts traveling through the blood vessels of the body until it obstructs one of those vessels. When we talk about Virchow's triad, we're talking about factors that increase the risk of thrombus formation. Before we conclude, I want to leave you with a mnemonic that will help you remember the three factors of Virchow's triad. And that mnemonic is SHE. S stands for stasis, H for hypercoagulability, and E for endothelial damage. And these are the three factors of Virchow's triad. It's very important that you remember these factors and apply them in clinical practice. Thank you everyone for listening, and we'll see you in the next video.